Dr. Chikwe, so as you rightly said, that sometimes people don't value public health because they don't have role models to follow, or they don't have examples to show. And you've been one person who really inspire a lot of young public health leaders on the continent. You currently lead the WHO's Hub for Pandemic and Epidemic Intelligence. Um, in that role, what have you seen as some of the critical gaps in global pandemic preparedness and response? Um,
Thanks, partner. During the pandemic, um, I had to stand in front of Nigerians every evening to update them literally every evening on live TV. The whole country was watching, Nigerians all over the world, everyone interested in Nigeria. The many countries were shut down, not only our country. And so we all focused on TVs and internet and focused on the live broadcast, and I had to explain to people, you know, how was this virus spreading? Who was being infected? What are the risks? What did they do about it? And we just did not have the data to answer the very complex questions on spread, on impact, on morbidity, mortality that we had to, or what we should do about it. And this wasn't just me, it was a shared experience. If you look at the US, you can identify similar people on TV every evening. In Ghana, every country had someone responsible for explaining to the population what was going on, right? So this was a shared challenge. And so the work that we're doing at the WHO Hub for Pandemic and Epidemic Intelligence in Berlin is really responding to that problem. How do we collectively get better at collecting better data, analyzing that data better with the agility, flexibility, and using it to make better decisions so that we can have better precision on the decisions that we have to make every day. So rather than having to close down an entire country, can we have more targeted interventions at the source of emerging infection or at a population that is most at risk of severe outcomes from a specific new infection or old infection? And with better data, we're able to do that. Better analytical tools, better understanding of genomics, better understanding of disease dynamics, how it spreads in populations. And really, that's what the hub is doing. This is a long game. So some of it is around building new technologies, some of it is about bringing together professionals working in different spaces to think together. Some of it is about uh, organizing institutions, national public health institutions, to have new departments that understand artificial intelligence, understand
Mhm.
large language models, and how to use that to interpret data systems. Some of it is just about making sure that data systems are able to speak to each other and have the ability to connect. So it's an exciting set of challenges that we face, and I'm really proud to be at the heart of a team of colleagues that are trying to solve some of the hardest problems in the world today. So when we do face the next pandemic, which will inevitably come, that we're in a much stronger position to rapidly understand what is going on, assess the risk, define response measures, and support the world in rolling out these measures so that we're not faced with the tragic situation that we were faced with 3 years ago, where we had to interrupt so many aspects of day-to-day life around the world.
Yeah, and some of the issues that you've raised are very, very critical, especially in getting prepared for the next pandemic. And I know one of the areas that it's also becoming very mainstream is the issue of collaborative surveillance. So, given the importance of real-time data in managing public health crisis, how do you see African countries in particular becoming more actively involved in collaborative surveillance initiatives? What steps do you think should be taken to ensure that African countries are beneficiaries and also contributors to global health intelligence networks.
So, Banda, one space you hear about what young Africans are doing in fintech, in all sorts of industries at the moment that are driven. Ultimately, all of these industries are driven by data, right? It's data analytics at the back end of all of them, whether it's fintech, whether it's all the mobile applications around the world. The question really is, how do we attract those people into the public sector? Because public sector salaries are low, conditions of service are low, and many young Africans are not aspiring to come into public service. So I don't for one bit doubt that we have the ability, the capacity to do the same things anyone can do around the world. That our challenge that is in a way unique to our continent is, how do we attract the talent that we need into public sector, into the spaces that they can drive this collaborative surveillance approaches. What is collaborative surveillance? It's bringing together the data streams developed for different diseases, whether it's wastewater surveillance, uh, indicator based surveillance, event based surveillance, population data, travel data, together to inform decision making. To do that, you need uh, data analysts, data scientists. We have them. The challenge is they're not streaming into the public sector looking for work because the incentives are not there. So our collective challenge really is to create the conditions of service in the public service, in the public sector, to attract the talent that we need to do the things we need to protect ourselves. And this is not unique to public health. It's the same challenges. Who are the people coming to work in security services? Very hard to attract talent into the security forces, to the justice system. And these are parts of government that the private sector cannot solve for us. You can't have the private sector do our judiciary or our security or large parts of health and education. We need the public service to work, public sector to work on our continent, and we need to attract the talent to do that. And that's maybe at the heart of the challenge of our generation.
Yes, yes. And I think you've highlighted a very important point, that we have the talents, but as you said, the incentives and the motivations are not there, particularly when, for example, we all see the kind of display in of our politicians in the public space. um it's 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 a difficult task, but hopefully we can get to a point where um those with the expertise, those with the talent are attracted back on the continent to really contribute to some of these amazing initiatives. So before we move on to the other segment, what really do you see are some of the most significant public health challenges that are currently facing African countries?
Like I write in the book, An Imperfect Storm, we write about a storm, and we really write about how Nigerians responded, how people working in the public sector did their best to respond. And I think while I'm extremely proud of that response, what really worries me is what we do when there's no storm, right? Um, you know, all these things that happen quietly and all the time in public health. The maternal mortality, the number of women that die in childbirth, the number of children that still get malaria, the number of malnourished children, the are dying of undernutrition or malnutrition, and then combined with the continuous evolution of diseases that are extinct in many parts of the world. The fact that people are still having cholera. We're not talking about new emerging viruses. We're talking
Mhm.
about old diseases like cholera. We're talking about measles, for which there's been a vaccine for 50, 60 years. So really, I think our biggest challenge is, how do we raise the attention of our leaders to health? How do we get health onto the political agenda? How do we get people to vote politicians in and out of office because of what they do or do not do on the health of their people. Infrastructure is on the minds of people very much. Security, we have many challenges. Petrol these days in Nigeria is a big topic. And all of these are important. I'm not saying they're not important, but somehow in that political agenda, we have to get health just a little bit higher on the political agenda of our politicians on our continent.
Yeah, I agree with you on that. I think the prioritization of health, it's something that has to happen before we can see significant change in the way we respond to some of these emergencies or even some of these endemic um, conditions. So thank you so much for sharing that.